Hello, good morning. Welcome to Eye Care Beyond the Eye Clinic. This is the second series, and today we will be talking about the external and the protective features of the eye. Don't forget to like, subscribe, and share this video. Now, going straight to the business of the day, we have the external features of the eyes, which include the orbit, we have the eyebrow, we have the eyelid, the eyelash, we have the conjunctiva, the cornea, though they are not shown in this picture, but then we also have the lacrimal system. Now, these six structures are very protective in nature, and we'll be discussing them one after the other. Probably in subsequent videos we'll be able to elaborate more. Now, orbit comprises of the bone cavity that contains the eyeball and its muscles, its nerves, and blood vessels, as well as the structures that produce or drain tears. And the orbit protrudes beyond the surface of the eye. Now, this particular bony structure of the orbit protects the eyes while allowing free movement in different directions. So you're able to move up, down, left, or right, depending on the direction you want to go. The orbit is responsible for this. Let's take a look at the eyebrows. Now, the eyebrows have two muscles that act to elevate it, that's to raise it up, and then there's another muscle that helps to depress it, that's to bring it down. Now, the two muscles I'm talking about are the frontalis muscle contraction, which elevates the eyebrow, and then the first orbicularis muscles, which depresses the eyebrow, enables you to bring it down. Now, the skin of the eyebrow is thick with large hair follicles, which have associated sweat and sebaceous glands. We'll look at the functions of the eyebrow later, but then always remember this, that if the eyebrow weren't there to form a barricade or to reduce the direct effect of things coming from up, just imagine what will happen if the rain were to directly hit your eyes and the eyebrows are not there, the lashes are not there, the eyelids are not there. That's what we're talking about. Now, the eyelashes. The eyelashes can be short. Some people have short lashes, some have average length, some have long lashes, and they grow from the edge of the eyelid. Now, the upper eyelashes are usually longer than the lower lashes, and then the upper lashes turn upward and the lower lashes turn downward. Now, these positions are very important, as any form of deformation or misdirection of the lashes can result in far more serious visual consequences than you can even imagine, including blindness. Now, what's the function? The eyelashes keeps insects and foreign particles such as dust, debris away from the eye by acting as a physical barrier, by causing the person to blink by reflex at the slightest sensation or provocation. Now, the upper and lower eyelids are thin flaps of skin and muscles that can cover the eye fully. Now, this is also very important, because if a person blinks and the eyelid is not able to cover the eye fully, there are several conditions and there are several complications that can arise from that. So just take note. We'll talk about it on later date. Now, they have both voluntary and involuntary control. Like, you can blink your eyes sometimes when you want, you can close them when you want, you can open them when you want. Now, that's the voluntary control. Now, for the involuntary control, this is a case where maybe an object is coming close to your eyes and you have to blink by reflex. This one, you didn't plan for it. It's possible you didn't even know, but they are designed in such a way that they are able to perceive what will be termed as danger to the particular structure we're talking about, which is the eye. Now, they also form a mechanical barrier that protects the eyes from foreign objects, wind, dust, insects, and very bright light. The eyelid and the eyelashes actually work hand in hand, because no one can move without the other to actually protect the eyes. Now, let's leave that for a bit and then come to the conjunctiva. At the back surface of the eyelid, and even the white part of the eye that we see is not exposed, there is a transparent membrane that covers it to protect it, and that's the conjunctiva. It loops around the cover to cover the front surface of the eyeball right up to the edge of the cornea. Now, the cornea, you see that colored part of the eye, some have black, some have brown. It's not exposed as well. It's actually covered by another transparent sheet that doesn't have blood vessels at all, and it's very, very transparent. And in fact, it is also said that it has the highest pain receptor in the body, and it is called the cornea. And there is a junction where the cornea covers that colored part of the eye, and then the conjunctiva covers the white part of the eye. Now there's a point where both actually meet, and it's called the limbus. It's just around the edge of that black thing, in your eye, the iris. It's at the edge of the conjunctiva. That's the limbus. That's also very significant, especially when we come to care as regards aging and all of that. There are some factors that we cannot control, of course. Now, the cornea doesn't like foreign bodies. Any little thing that goes there will cause you a high level of discomfort than you can ever imagine. Even if it's your eyelash that falls there, or a tiny piece of sand that gets there, it's going to cause you a lot of discomfort. Now let's quickly look at the lacrimal system. It is important to know that every time we blink, the eyelid helps to spread tears evenly over the surface of the eyes. Tears consist of a salty fluid that continuously bathes the surface of the eye to keep it moist, and also to transfer the necessary nutrients needed to the cornea, because the cornea doesn't have blood vessels, and as such it's not able to help itself. Now if this cornea is left dry without any form of tears, a lot of complications can actually arise. So when we close our eyes, the eyelid helps to trap those tears in place on the surface of the eye to keep it moist. Now without the moisture, like I was saying, the normal transparent cornea, the one that you cannot see, that makes you feel the iris is exposed, it will become dry, it will become injured, it can become infected, and it can become opaque. That no longer see through. Now tears also help to wash away dirt and particles that enters the eyes. So tears are also rich in antibodies and helps to prevent infection. Now it's very important that you note this, that the eyelid and the tears, they also have a role to play when it comes to our abilities to see. In fact, the tear film is the first refractive media of the eye and not the cornea. The tear film is the first refractive media, so you can imagine what dryness of the eye can actually do to your vision. Dry eyes have actually been reported to also have the ability to cause blindness, which we've explained, because when the eyes are dry, the cornea will be affected. So that tear film is your very first refractive media. In our next series, we're going to be focusing on each of these layers I just talked about. Please don't forget to like, don't forget to subscribe, don't forget to share. Join me next week for another educative and enlightening series on eye care beyond the eye clinic. I remain your favorite doctor, Dr. Khan.